Welcome to The Next Word. I'm your host, Chris Warnke, and today we have two special guests to talk about food insecurity for children in the county, Montgomery County, which is probably one of the highest in the state of Maryland today. Maggie Davis, as well as Netta Squires, both who are in contract with the Center for Health and Homeland Security out of the University of Maryland, Baltimore, and who have been champions for our children in Montgomery County. So welcome to you both, and thank you. Netta,
Thank you for having me.
Thank you, because it's such a critical issue right now. And as we know, with COVID-19, it's become even more devastating. And both of you are just our leaders, and you're part of, I know, a larger team, but we're so proud of you, and thank you for all the work you're doing for the county, and specifically, of course, for children that are really, truly, many of them are food insecure. So thank you. So Netta, starting off though, I mean, you're contracted with the county, correct?
Yes.
And I know, and the whole program, I mean, I mean, you've been with the county for how long, first of all?
So I've been with the county for just under 4 years now. And so we are, as you mentioned, we are work for the Center for Health and Homeland Security for the University of Maryland, Baltimore, which is the law school. And we're contracted out to Montgomery County Office of Emergency Management and Homeland Security to help with emergency preparedness. And so actually, Maggie was my predecessor. She had my job before me for, I think, about 4 years as well. So there is a lot of continuity. So we've been working together for quite a while. And in our office, we were part of the planning team, planning division. And so we work on emergency preparedness, training, exercise planning for the county and the entire region as a whole, actually. And so when this started, I was deployed to public health planning, to the Public Health Command Center to help over here. And as part of my duties for the county, I was required to, several years back, write the volunteer and donations management plan for the county. So I had a lot of touch points with a lot of our communities that are more at risk and are a lot of the communities in the nonprofit world that work. And so when this disaster started, I was able to become a part of these groups and learn a little bit more about what their needs are and understand some of as I was reaching out to our nonprofits, I was realizing that many of them are trying to serve so many clients, but have a lot of shortages, even with simple resources like hand sanitizer, face masks, and things to be able to even conduct their work. And really, that's kind of how it started, in addition to understanding that the food providers, that people didn't have access to transportation. And then Maggie and I started working together. We developed the Food Security Task Force under the Office of Emergency Management, but it is actually a combination of nonprofit and county government. And so we have people in the leadership and in the entire force who are a part of HHS, Health and Human Services for the county, the Department of Health and Human Services, and we have people who are from the nonprofit world and who are from the food providers. And then, of course, we have just people from throughout the county. And so it is really a team effort meant to be sort of a holistic approach to being able to tackle the situation, since it is much greater than one person can do.
Right. And I mean, the statistics are really alarming in terms of children food insecurity. I mean, it's over 16% in the county. Is that correct? And is that pretty much? It's a startling statistic, actually, which was startling to me, having come out of Montgomery County as a student and as a child.
Oh, I'm actually not sure where that statistic's from, but there is a concern about food access for youth in the county, which is why one of our biggest partners is Montgomery County Public Schools, which has really expanded its overall support for food access for youth in the county. So children 18 and under can pick up meals most weekdays at about 50 school sites. In addition, the schools have been in certain neighborhoods providing bus routes of produce for families. So the county has really expanded its access, particularly through the public school program, and that's something we're really excited about in the Food Security Task Force, to have such a strong partnership from MCPS.
So Matt, that's terrific. So what's going to happen though? I mean, now we're coming into the summer months. So does this continue? Certainly, for the next 3 months until school hopefully opens in the fall, but this kind of utilizing the schools to provide the food, which is great.
Well, I do know that MCPS and the state of Maryland have been working for continued operations through school lunches over the summer. That's something they have done in the past, but they have also been looking to extend the waivers they've had in place to provide this higher level of access for food resources for students over the summer. So the Montgomery County Public Schools have been doing all that they can to make sure that they keep up this same level of support to the students who do need access to food.
That's great. And in Montgomery County, as I know it, there are a number of nonprofits that have really come forward and are participating with you, correct? And I mean, like Up to Us, which of course is run by Tazeen Ahmed. I mean, there are a number of them. Are you seeing more and more of this in terms of community outpouring for assisting? And I mean, what are you seeing on the ground in terms of people really wanting to help?
So I think there's so many organizations. Many organizations actually already have contracts with the county and they're expanding their operations. And many organizations are just shifted their operations. I know, for example, one of the organizations that we created as a framework for the county was the Community Organizations Active in Disaster. And these organizations have just shifted their entire operation to assist with COVID related response. And then of course, organizations that were already doing feeding have had to increase their capacity and ability exponentially. Obviously, hungry children is a heart-wrenching reality, but unfortunately, this has also become the reality for many other residents that are experiencing food insecurity for the first time, or their existing food insecurity issues have just been exacerbated. And so we've seen a lot of organizations that have had to expand, and then a lot of new organizations that have created food pantries, and many even just pop-ups, right? As the food becomes available, they pop up and provide it to residents in the form of drive-through, often weekend drive-throughs. But taking Tazeen's organization as an example, I believe she's expanded her operation significantly. If you want just a few sort of numbers from this past week. So the Food Security Task Force, every week we provide a weekly report, basically on the week previously of what has been accomplished, and then kind of looking ahead at what we're going forward. And we rely on providers to to fill in what we call the weekly snapshot. And this last week, out of 20, only 20 providers, and so 20 providers is not even close to a third of the amount of providers that are in the county, right? We probably have closer to like 80 to 100 providers. But out of 20 food assistance providers, they provided 350,000 pounds of food, right, to Montgomery County residents, and served over 13,000 or just under 13,000 clients. And so, this just emphasizes the immense need in the county and the food insecurity, because of course there's the economic issues that are causing food insecurity, right? People are out of work. Some people that were already on low wage payments, and then others that just have no wage now, right? That worked in the food industry or specifically, or many other industries that have completely shut down. And so they're obviously suffering more now. But then of course there's also our high risk populations, people who are not able to leave their house to go shopping on their own. They don't have someone else to shop for them. There's supply chain issues that are caused even when you go shopping, there isn't anything to buy for certain specific items. And worse for our food pantry providers, and maybe Maggie can talk a little bit about what they've been doing for that in a moment. And then of course there's, you know, if you're sick, so, or if you're not necessarily sick, but potentially sick, so if you're quarantined or isolated, right? You can't leave your house during these COVID times. And so how do you get to you? And, you know, there's been a transportation reduction. Now we're starting to reopen, and so some of these issues are becoming a little, are alleviating slowly but surely, but many aren't, and the economic impacts are going to be felt for a very long time. So really the task force's mission was to sort of understand the underlying issues and weave in solutions, because, you know, from an emergency management perspective, our job is to coordinate. That's what, we don't have our own assets or our own resources, right? You know, emergency management, for example, doesn't own fire trucks. It doesn't go fight the fire, right? It doesn't own the food, but we have the capacity and the mechanisms, the relationships to go and find who does and put it together and coordinate the framework. And, you know, I think, Maggie, do you want to talk a little bit about the food delta, which we've tried to cover in this past week? I think it's a great example.
I want to kind of start with one thing. The task force, as Netta said, we are a coordinating entity. So we really do rely on the strong relationships, both of government partners and non-government partners. And there have been a number of things that by building this kind of one group to address the broader food security concerns within the county have really become a strength. So one of the things we did early on was create a response strategy that really focused on getting more food into the system, as well as working to identify better ways to outreach to residents in need. So one thing that we've learned recently from some of our 311 data is that some of our outreach efforts have been incredibly well received because we've had a better connection to non-English speaking communities, connecting to resources through 311. We also have been working with the providers to address kind of shortcomings and stopgaps as they've seen within the overall food landscape. For example, some of our major food bank kind of wholesalers, so they're in the overall food bank network, there are several groups that are the bulk purchasers that then distribute the food to these smaller providers that are able to kind of be a little more nimble in the community and maybe reach different communities to get food to them. The wholesale bulk purchase providers have experienced severe supply chain disruptions. For instance, one of the main providers in the National Capital Region has seen a 6-month lag in ordering tuna fish, which is a staple item that they give out at pantry distributions as a shelf-stable protein source. With knowing these kind of long delays in getting more food into the system, what the county has started doing is that we've actually worked with partners in different supply chains to access some of the shelf-stable food items. So the county, in its role in the task force to help support these nonprofit providers, are purchasing at wholesale, so less cost than retail, but still a little more expensive than the normal food bank network. What we're calling the Delta purchase, where we are trying to bridge the gap between what the providers are able to get through the normal food bank supply chains and the actual amount of food they need to meet the demand within the community. So we've been working kind of collaboratively as possible with a wide variety of providers to identify how much more food do they need to meet the demand they're seeing, as well as how to try and buy down the risk from these bulk purchasing food assistance providers so that they're able to be a little more resilient to some of these supply chain disruptions.
That's great. We are amazing. We are going to take a short break and we'll be right back. So I want to talk to you, take you back 4 years, take us back to talk about, you all wrote a pandemic plan 4 years ago. We'll come back and talk about that. You're watching. You're watching The Next Word. We have two champions in Montgomery County with the Center for Health and Homeland Security out of the University of Maryland, Baltimore, who have been on loan to Montgomery County government to assist the residents of the county with food insecurity. They are Netta Squires as well as Maggie Davis, and we owe a deep gratitude to both of them for what they're doing and what they plan to do in the next 6 months. Netta, I'm going to turn to you and come back to another question for you, because I know that at one point you put a plan together along with your colleagues, a pandemic or disaster plan several years ago. Can we talk a little bit about that, given that we're in the middle of a pandemic today?
Sure. Public Health did put out a pandemic plan, which they were actually about to revise this year. Unfortunately, COVID hit before that, so they'll have plenty to revise on the plan about the pandemic itself. As it pertains for food, though, as you said, we did write a plan, and one of the first things that the Food Security Task Force did when we assembled was write the strategic plan for food. And this plan really addresses how we see being able to solve or at least facilitate county residents having food, getting more food to more people over the next 6 months, starting from immediate actions, right, such as providing grocery bags to our food distributions and a response mechanism and capacity, and then all the way to how we deal with the second pandemic. And actually, I'd like to invite my colleague Maggie to talk a little bit more about the specifics of the plan.
Yeah, so the plan is called the COVID-19 Pandemic Food Security Response Strategy. And this was, the version 1 was released May 1st, looking at an overarching strategy on how to increase food security access for the next 6 months. The number one action to take was to enhance the existing food supply chain by infusing kind of more food into the system through ideally the regular food bank networks. For those that are familiar with food banks have a purchasing power that is much more cost effective than you would get at wholesale or retail value. So it is an easier way to bring in more food into the system. So our initial goal is to bring in more food and try and kind of enable our food assistance providers to stock up to mitigate against supply chain disruptions. Unfortunately, we've seen a lot of supply chain disruptions early. So we, as we talked in the earlier segment, have started to use the Delta strategy, where we've been buying that difference of food at the wholesale prices in order to meet the overall gap. The other unique aspect of this plan and more food is that we have a robust plan on how to get prepared meals to individuals that are having to shelter in place due to either exposure to COVID-19 or being of high risk categories of groups and unable to safely go out themselves. So that is a portion of the strategy, but we also have some longer term strategies. For instance, enhancing the farm to food bank program. There are existing programs that partner local farmers with food banks, and the local farmers, there's kind of a double benefit there. If we can make sure the local farmers are able to get a lot of their base costs covered versus losing funds during this, tumultuous economic time, as well as getting fresh and nutritious food into the supply chain, that's an overall win for Montgomery County residents. A few other items that we've been working on is a expanded outreach program for Supplemental Nutritious Assistance Program, SNAP, also formerly known as food stamps, and really educating community members of how they're able to sign up for SNAP, whether they're eligible for SNAP. There have been expanded benefits due to the pandemic in SNAP programs. So really putting an emphasis on outreach and education to make sure that residents that are eligible for these programs that will help them get food are able to sign up for them and have resources available to them to help them sign up. And I know Netta's been working really closely with one of the main outreach and education things that we've been putting together, which is a food access call center.
That's great.
Yeah.
Netta?
So thanks, Maggie. Yeah, so we understood early on that it wasn't just a matter of creating the framework, but it's also making sure, like Maggie said, that people have access to it. If people didn't even know where to begin to call to ask for food, right? At a time when you lose your everyday communication fabric with people, right? When you don't go to your church and just hear someone over say something, or tell someone that you're not feeling well. You don't have your friends that you hang out with that can just chit chat about. You lose those very basic communications that you rely on to get information. And you may be embarrassed to ask for food. You just may not know what's available. You don't even know what to ask for sometimes. And so we created the Food Access Call Center. And essentially, this is a way for people to get connected to specific food resources that are appropriate for their needs. So for example, if you are an elderly person in a high-risk category and are not able to leave your house, but you have means to buy the food, you just don't have the ability to physically go get it, then there are specific resources that can be better suited for you, like volunteer groups who do deliveries, for example, or deliveries straight to your home, right? But if you are economically insecure and you have a child with formula needs, for example, in addition to a child who's school age based, in addition to an elderly program, you might be eligible for 3 different programs that you never even know existed, right? For example, our WIC, our Women and Infant program, and senior meals programs, and MCPS, Montgomery County Public School System food distribution, in addition to food pantries that are in your area. And so understanding it is more of a case management need to assess these food needs. And so we created the call center. The way to reach this call center is really to just dial 311 and ask to be connected to the Food Access Call Center, or just ask to be connected with food resources, and they will direct you to our call center. And you will receive a call back from one of our representatives. And really, we're enhancing our language capabilities. And so we have people, unfortunately, we've seen that many of the calls coming in are from our Hispanic and Latino populations. So we're working on enhancing our language capabilities, and we do work with language line, and so we really are able to get assistance in every language that that is able to call. And so we also have food resources available on our Montgomery County website. And so if you go to our website, it is under the resources section. There's a food resources, and that will really lead you to many different programs. Maggie mentioned SNAP earlier, and that certainly has had a lot of expanded benefits added to it. And in terms of how you can spend your food, you can now even purchase food online with it. And so that will lead you to many of the available programs and pantries and pop-up events and methods how to get food.
And one more fantastic resource, one of our strongest partners in this effort is the Montgomery County Food Council, which is the nonprofit in charge of kind of coordinating food policy within the county. And they have created a food resource map that is accessible through that website, where you can actually search by your address to find what food pantries and distributions are closest to you and what languages they support, whether or not they support delivery. It's really a fantastic tool, and that partnership has been really instrumental in the success of the overall task force.
That's great. Netta, I think I recall that you had done work with post-incarcerated residents as well. I'm assuming this was back in when you were in a previous job. Can you talk a little bit about the residents, the post-incarcerated community, which of course are also underserved?
Yeah, I mean, you used the word for it, right? Underserved. Unfortunately, this disaster has left no one behind. It has
Right.
exacerbated already extremely difficult um, underlying issues in our community that existed before. And certainly, if you didn't have a lot of means, such as like most incarcerated people often don't, you're probably hit much harder now. And that's really part of the reason that, you know, we're trying to work so hard to make sure to get all these different transportation mechanisms and resource mechanisms and food. And we're developing hubs now. You know, you mentioned communities that need more than just food, right? If you are food insecure, you're likely also you probably have a lot of other needs, right? You probably need diapers, you probably need just general hygiene products. And so we are hoping to also expand the call center and be able to really give a more holistic approach to your needs and be able to refer you to many more services. A lot of our partner organizations are actually doing that and created a hub model in which you can basically sort of have a one-stop shop to healthcare access, right? And food and other necessary items.
And that's so critical. I mean, things that people take for granted, feminine hygiene products or Pampers, others, you know, are badly needed, particularly right now. And so at the churches, I wanted to talk a little bit about the churches. I mean, given that people have not been able to go to places of worship, so they can't have the communication stream that they normally would have. You made a good point, Netta, before, you know, that having this education outreach is so critical now, because it's through the churches that you do have this communication.
Yeah, and we have some fantastic partnerships within the county. The Office of Community Partnerships has a faith liaison who has done a great job of, you know, staying engaged with faith communities and been very involved in this issue as well. Many of the churches have pantries themselves, and a lot of our kind of pop-up distributions have been affiliated with faith communities. One other thing I did want to bring up that the task force put together early on was a food access grant program for non-traditional partners to be able to provide food directly to their communities. And so I believe it was 38 providers that received food access grants, and a number of them were faith organizations that were looking to provide food within their overall community in the county.
Oh, it's fabulous. Well, I feel like Montgomery County really has served as a model, certainly for the whole region. And as a product of Montgomery County, I can tell you that I'm personally very proud. But truly, you all have. I mean, you put together this amazing network.
Well, we've been very proud of the partners we have. Montgomery County has a fantastic kind of network of nonprofit leaders, faith leaders, civic organizations that have really stood up to this challenge. And it's been very nice to collaborate with other jurisdictions in the region as well. So as part of the Emergency Management Network, we do collaborate often with other jurisdictions to learn best practices, to kind of brainstorm solutions to issues that we're seeing in multiple jurisdictions. So one thing that we've been a part of is the Metropolitan Washington Council of Governments have set up a kind of working group on food supply chain disruptions. So we've been working with other jurisdictions to figure out, you know, are we all seeing similar supply chain disruptions? How are each jurisdictions addressing the issue? We've also had some great collaborations. For instance, we're collaborating with some partners in Baltimore to make sure that our kosher food distribution went as well as it could be. So we've really worked as strongly as we can within the network of Montgomery County, but also within the entire national capital and greater Maryland region.
Right.
If I can just touch on, just one of the points that Maggie just brought up about the kosher. I mean, I think what's really interesting about Montgomery County is that it services so many culturally diverse populations. And, just because it's a pandemic doesn't mean I've learned to like certain foods or that I've stepped away from the foods that I, that are important to me for my religion and so really one of the main focuses is also making sure that we serve culturally appropriate food. Maggie mentioned kosher during Ramadan and every other day, quite frankly. We've been making sure that we serve halal food. We're making sure to cater really, specific foods to the populations that we need and make sure to find these hard-to-reach communities.
Right. Well, we're running out of time, unfortunately, but you've all been great. And thank you on behalf of everyone in this whole region and the nation. We're grateful to both of you. I want to bring you back at one point in the near future. But thank you.
Thank you very much for having us, Christine.
And
we appreciate giving us the time on the show.
Absolutely. And Maggie, thank you.
Oh, thank you, Christine. It's great to be part of the overall partnership here in Montgomery County.
And this is part of it, getting this message out. Thank you for watching The Next Word. If you're having trouble with any kind of food insecurity or other issue, please call the 311 number, Montgomery County, or go to the website and there will be assistance there. Again, thank you for watching.